Well, here it comes, the individual mandate. Today, the Obama administration telling us how the most unpopular part of Obamacare will be implemented. The IRS and HHS issuing thousands and thousands of new regulations, laying out exactly who will have to pay and how much. Those are just some of the 13,000 regulations in the health care law, all written by bureaucrats, people that you and I didn't elect and who get to keep their jobs even if we don't like what they do. Congressman Adam Kinzinger joins us. Good evening, sir.
Hey, Greta, how you doing?
I'm very well. So what about the mandates? What did we learn today? Because there's been so much mystery discussion and talk about it for the last 2 years.
Well, it's more regulations out of the administration. But let's talk about, first off, I think the individual mandate, it's unpopular for a reason. It doesn't work. I oppose it. But the theory behind it is this. The theory is everybody will be forced to buy insurance, and then obviously you're sharing the risk pool, and people aren't going to go to the emergency and things along that line. Well, what we saw with the new regulations today is actually the Obama administration came out and said, okay, the penalty if you don't buy insurance is $95, and ultimately it'll go up to like $700, so it's cheaper to pay the penalty. And then you also saw in that a whole host of exemptions for people that don't need to fall under the requirement. If you don't have a federal tax burden, you're not going to be penalized. And again, I think the individual mandate's wrong, but under that theory, what this is in fact doing is exempting a lot of people from having to buy insurance, but it's not changing the part of the law that says an individual can still say, oh, I got a huge problem, I'm going to go buy insurance, I'm going to utilize this insurance until my problem's over, and then I'm going to dump it. And that cost then is placed on everybody else that's owning insurance for the long term. And these penalties are not such that it's going to force people to buy the insurance. Instead, they're going to go back to the emergency room.
Well, the whole idea is that if everybody pitched in, everyone who could, for whatever reason, that that they didn't have exemptions, and people, people could pitch in, is that it would lower the cost for everybody. To the extent that people get exemptions for religious affiliation, I think there's some, and there's a whole bunch of different categories of people who are exempted or waivers. Or that if you'd rather take a chance and just pay the $95 and not pay the individual mandate, that means that the costs are necessarily going to rise for everybody else. So it's not quite as cheap as everyone had at least the administration had said it was. Is that true?
Yeah, that's right. And let's say you decide I'm going to pay the $95, or let's say you're a small business owner and you decide to put your employees on the public exchange instead of paying for insurance, which is cheaper. But if you decide that and then you get sick, you say, well, I'm going to go get insurance. It's going to pay for this problem I have, and then I'm going to dump it again and go back to paying the $95. Again, the whole system, the whole theory behind it is flawed. It doesn't work. That's why the Obama administration frankly promised health insurance costs for a family. They said it's going to go down $2,500 a year, and we've already seen it in $3,000, and we're really at the beginning of these the premium increases we're about to see. This law, in a lot of theories, and I'm kind of believing it, this law was built to fail because the next step then is to say, boy, those evil insurance companies are raising the price even though it's a flawed system, and then to go to a single-payer system after this, which is the goal of the left from the very beginning. So it's a very scary thing. I think there's a trust deficit between the American people and the president on the health care law, and we see that with the thousands of pages of regulations today.
Well, let me just take one last word on this. The thing that always struck me is it's 2,800 pages, and every member of Congress who voted on it and didn't read it, which I think is peculiar. But then the 2,800 pages was taken over to the IRS and HHS, and then people that we never elected or voted for, they're the ones who wrote all the intricate regulations, and suddenly, that Congress and the president had outsourced it to people we don't even know and hadn't voted for. They make these regulations. So we're going to see how this plays out, but at least now the numbers right now don't quite add up. But we'll see. Congressman, thank you, sir.
Hey, thank you.